Okay, so the easiest rhythms to start to look at when we're learning EKGs are normal sinus rhythm. And that's the one we see in the textbooks. That's the ones that we see most of the time in the hospital. Okay, so normal sinus rhythm, remember it's sinus, and so that tells us that it starts in the sinus node, the SA node, and then travels to the AV node, and then to the rest of the heart. So that's what sinus rhythm means. Okay, so we're going to analyze our rhythm, our beat here, our rhythm. Here's the list, and I just wrote a kind of a shorthand of what I have up here. So this might be something that you write down on your note card or sticky note or clipboard or whatever it is that you carry around in clinic, or you might want to write on your exam sheet or your scratch paper, whatever it is that you're using to analyze your strips. Okay? So when we look at sinus rhythm, first we say, is there a P for every QRS? Well, normal sinus rhythm, yes, we have to have a P for every QRS. Then we look at the rate. Well, the rate should be normal, 60 to 100. And it should be regular. We have a wide or a narrow QRS? Well, normal sinus rhythm, the QRS is less than 0.12. All right, so it's narrow. And then we measure our PR, and it should be normal, 0.12 to 0.2. And then do we have any abnormal beats? And we would say no. Now let's say you had this normal sinus rhythm and you had PVCs. You had apparent, every once in a while you'd have this big wide beat with no P wave, and generally no T wave. Then you would say I have normal sinus rhythm with PVCs. Okay? So that is normal sinus rhythm. Now, we also have these other ones here. We have sinus tach and sinus brady. So all the criteria is the same except the rate. So for sinus, so we did this one, sinus tach, then you have a P for every QRS. Your rate, though, is greater than 100. I have a regular rate. I have a narrow QRS, less than 0.12. My PR is normal, and I do not have abnormal beats. Then I would say I have sinus tachycardia. Okay? And then if I had a P for every QRS, but my rate was less than 60, it was regular, narrow, my PR was normal, and I had no abnormal beats, then I would have sinus bradycardia. So that one's pretty easy.